folks, whenever there's a crisis, a disruption in the market, for those who are entrepreneurs, you're always finding new ways to take a hold and get the opportunity, not to take advantage. That's a different thing. We're not gouging anybody. We're actually providing some services that are much needed for the doctors and also for the patients. And right now is a critical time where doctors themselves are in pain more than they've ever been before. And again, you can be the solution, as you'll see today. So again, I welcome everybody to the webinar this afternoon. Patrick and I have a ton of information that we're going to want to go through. My name is Eric Auger. I am here at American Business Systems, not only doing research and development, but also helping out with our organization called MIRMA, and obviously helping Patrick out and working with you as trying to figure out if this is the right business model for you and for your future business here. So I welcome you here this afternoon. Folks, we're presenting to you truly what we feel like is the best business opportunity in the United States. There's no doubt that we've got a platform that is second to none. There is nothing out there on the market that our platform can't do, that any other, that what we're able to do, what others can't do. I'll put it that way. And if you'd like to know more about this, get back with the person that brought you or asked you to be on the webinar today, and they would be happy to do a live demonstration with you. Now, my co-host today is going to be Patrick Phillips. He is the founder and the CEO of American Business Systems. His wife was actually the one that began the whole medical billing business, and he'll share with you in just a moment. But ABS has been around since 1994 and is the largest network of certified medical revenue managers. We've got folks from coast to coast, all walks of life, people that have been in sales, people that have been building houses, people that were attorneys, people that have been in the medical field. So folks, everybody's come from a different walk of life. Patrick is a best-selling author of these 3 books and working on some more, as you probably already imagined. And then he is a contributor to the BC Advantage magazine. That's a billing and coding magazine. Patrick, we've got so much to pack in here. Let's get you on and let's get started here.
Well, now that I can see myself, I can tell you that it's definitely way past haircut time. Yeah. It's beginning to flip. Yeah.
All right.
I'm working from home, and so here I am. Here's the drawback to working from home. The drawback is that your refrigerator is just right over here, way too close. All right, I'm going to walk back to my office. I just thought I'd start out by letting everybody know that we're working from home. Actually, Eric looks like he's in a nice office there, but it's a fake backdrop. That's a green screen back there with a fake bookcase, I think. Isn't that, Eric?
I'll pull one of those fake books out of here in just a moment. Patrick, okay. This is a picture of you and Linda and your kiddos from quite some time ago. Tell us about this picture.
Yeah. Oh, wow. That does go back. That's back in 1987, I think. You know, I've got some feedback here, Eric. Let me mute everything here. But I think it's wow. Aren't I coming through somewhere? Yeah, here. Hold on. Okay. See, it is live. I had 2 mics going. My computer's on here, and I had the mic on that one. Anyway, yeah, this was when Linda actually started doing some medical billing for doctors in our area here in the Fort Worth, Dallas area. And she just accidentally got into the business, found out how simple it was. We started making some money. Our relatives were wondering what kind of drugs we were selling out the back door, because we had bought a new home and a new car. And so what happened, Eric, is that it became so profitable, I thought, you know, there's probably a business here teaching other people how to duplicate our success. So I put all the marketing materials together, came up with the training for it and the marketing materials. And well, it's 26 years in development. So we're still adding new marketing ideas.
Yep, and I think we'll share a few of those today. Now, Patrick, there are articles that are coming out left and right now, and I know that we're going to want to share some of this, but it looks like you're reaching for something there that you might want to share there.
Oh, well, when I mentioned that I'd come up with the training for this, this is actually the latest training manual that people get when they go through our online training. As you can see, it's, gosh, it's probably 250 pages of materials. it continues to evolve as we go through the years, Eric, and we continually change it and adapt it to the times. For example, right now we're in this weird situation where we are supposed to be social distancing, and so people are asking, how do I go out and market to doctors? Well, we found that the doctors don't mind seeing one-on-one people like yourself who have a solution to their problem, and we're going to see some of those problems. Look at this one here. This article, for example, that I found, Eric. Let's see, what is this dated? March 31st. Yeah. And as you can see, it says the practices cannot survive the COVID-19 cash flow crisis. That's why we named this webinar that, because this is a serious thing. It says, will doctors be able to keep their practices open during the worst pandemic in our lifetime? Our country needs every available doctor in the country to fight the challenges of COVID-19. And doctors working in the independent practices face an immediate cash flow crisis, threatening their ability to continue services. So, Eric, I always hate this, because when the economy goes bad, when there's a change in the way we do things in the medical field, like when Obamacare came along, that seems to spark interest in our business, and doctors all of a sudden wake up and go, I gotta get with it here. I'm not going to stay in practice.
Right. Yeah, there's a lot of independent practices that are trying to figure out how are they going to stay afloat. We've got some solutions right now that we just added for the doctors and to help them with their cash flow with an immediate need, like right now. So we're going to kind of share a little bit about that as we go through the presentation. Patrick, this article just came out April the 4th about some hard lessons about taxes. You want to share about that?
Yeah, see, here's another thing that's going on right now. Starting April 1st, smaller healthcare providers, including skilled nursing facilities, will start paying higher business taxes. Now, of all times, Eric, for this kind of thing to happen to doctors, they certainly don't need higher taxes, but all the more need for people like the folks that are on this webinar who are looking to get into this business, helping doctors with their cash flow and their revenue, their medical revenue. This is the perfect time for people to start this business, Eric. People are always looking at me and Lyndon saying, oh, I wish I had started my business way back when you did, and now I'd be where you're at. But folks, this is much better timing wise to start a business like this than when Lyndon and I started, because we didn't have any help. We started from scratch.
Right. And
we had to reinvent the wheel.
Yeah. And this article came out March the 29th. And this is what I found, opening an independent practice. So not only are some independent practices struggling, we're also seeing some doctors trying to get back into independent practice.
Yeah, it's weird, because we did hear, 2 or 3 years ago, that doctors were joining big practices and hospitals and things like that. And then when their contracts start running out in a couple of years with those hospitals, those doctors look at the situation and go, you know what, I don't like being an employee, being told what to do, how many hours to put in, and what to do for my patients. I like the independence. And so some of them have gone back into private practice, and of course, they're having to start from scratch.
Yeah, and so doctors like this doctor here, if you go read the rest of the article. Now, folks, if you want to read any of those articles, go over to the handouts area. We have downloaded in a PDF format for you to go grab that information, and you can go to those directly. Patrick, before we go to anything else, I want to actually show one more article that actually came out again, and I just shared this with our group of licensees because we're working on something directly that's going to help our licensees. And this has come out through Fierce Healthcare. Now, I've actually got it pulled up. This is live. We're looking at it right now. This came out April 3rd. So 3 keys for physicians to keep their medical practices running in the time of the coronavirus. If you look right here, look at this, Patrick. The coronavirus pandemic has left many physician practices struggling to stay afloat. They've lost revenue as the number of patient visits have dropped dramatically as people stay home to avoid exposure to the highly contagious virus. Specialty practices have also put off revenue producing elective surgeries and procedures.
Right, yeah.
See all of this that's happening, but I'm going to get down here where it finally says, find ways to bolster revenue. For many practices, this begins with telehealth services. I love this. If you are not on telehealth, get on telehealth immediately. and bill for those visits. Patrick,
Eric, I think that's the future, don't you?
it is.
I mean,
Yep.
why would you have to go see a doctor unless it's a real specific, broken arm or a rash or something? And even then, couldn't I show you my rash right here on the camera? I mean, there's no reason why we can't use the technology that we have. And I think this was a wake-up call for doctors.
Oh, it
So,
is.
so having said that, of course, Eric has been researching this for the past 3 or 4 months and has found a solution for our licensees that is just incredible. And the demand, Eric, I don't know if you saw that. I'm going to find that email. We just got an email from a licensee that just raves about the fact that this was the perfect timing for this service to be introduced.
Yeah, why don't you look for that? Because folks, what Patrick is saying, we have just added a new service, and it is a telehealth platform service. And folks, you talk about an opportunity that will help you get in front of a doctor faster than anything else is telehealth medicine. And we've got some slides here. We're going to show and share that with you in just a moment. And Patrick's actually looking up an email that came out from one of our licensees.
Yeah, okay, so I can't show it here. I'm on my iPad, but let me just read it here on my other screen. This is from one of our licensees. His first name's Alex. He says, Patrick, Adam, and Eric, I just wanted to send you a quick note to thank you so much for introducing the telehealth to us at this critical time when it is more difficult to, quote, sell to doctors. Your continued support of your licensees should be a model for other companies to follow. In the next 2 days, I'm scheduled to introduce a free HIPAA-compliant telehealth service to over, get this, Eric, to over 200 people, including 55 networking partners, family, friends, and professional contacts. My plan is for all of them to reach out to every physician they know and ask them to contact me to learn about the telehealth service. I could not have had a better tool for physician prospecting. Thank you, thank you.
That's
now,
awesome.
Yeah, anybody who wants a copy of that, we'll redact his last name and email address. We'll send that to you if you just want to see. That's as real as it gets, Eric.
That really is as real as it gets. Because folks, we're going to put some other stats up here, and then we're going to kind of get into the meat of what we're doing. You can see here for the first 15 minutes of the webinar, we haven't said really anything about American business systems except what is happening out there in the marketplace. And it is a grand time for you to be involved with this. If you're thinking about getting involved with it, now's the time, because you can see that our licensees are currently out there marketing a new service platform that we just launched, I think just last week, Patrick. I mean, we've kind of worked on it for the last few weeks, but we've actually got it launched, and it's launching again. And we've got another webinar this coming Friday on telehealth platforms and what we're doing there with our technology partner there. But folks, you can see here, 89% of all physician practices agree that their billing and collection systems need upgrading. And that's across the board, Patrick.
Yes. There's a question here from Amanda. Am I reading that right? Amanda. Okay. And it says, would you be able to share how many new license holders started businesses in first quarter of 2020? Now, I'm assuming she's asking about our license holders, what we call licensees, people who've purchased the license to run this business under us. I don't know if that's who she's referring to or not. But this is a good time for me, Eric, to kind of share with people that this is not some mass recruiting that we do. Folks, this is done one-on-one with you. We have what we call business development coaches or reps that you've been talking with, the people who invited you to this webinar. And we only run through our training maybe 1 or 2 people a week. It's not, very few people who come to these webinars actually have the funds and come up with the money to invest in something like this. So it's a small number of people. In fact, Eric, I would say we could literally say that we limit our licensing to about maybe 50 or 60 licensees a year. That's it. That's why, folks, when I tell you that our slots for our training are filling up, that's because we don't have that many instructors and we don't teach that many people. So it's very limited as to how many people we work with, because we then on the back end support and coach those people. And that takes personnel and time. And we're a small company. We're not a huge corporation. but we have enough people on hand, of course, to do the support and do the coaching for our licensees, because we make money on the back end as well. The licensing fee on the front end and the services and the fees that are paid by the doctors on the back end. So we have a vested interest in you being successful. Anyway, I just thought I'd throw that in. No extra charge for that.
I'm glad you did. And it's you just kind of just, chat with people, kind of one-on-one. And folks, we're going to take the rest of the time to kind of just go over who we are as American Business System, some of the opportunities that are here. You're gonna see Dr. Vicki Rachner's name come up not only right here, but later on in the presentation. But Patrick, she's written this book, The Myth of the Rich Doctor, and everybody thinks that doctors are rich, and they're really, just as we've already stated with some of the articles, some of them are struggling, and I think we're actually going to see some independent practices maybe close the doors simply because they weren't ready. They were at that point where they were just going paycheck to paycheck themselves, and just like anybody else that goes paycheck to paycheck, may find themselves, just as much in trouble as anybody else would be.
In most people's minds, Eric, if you took us a poll right now of everybody that's on here right now, how much do you think the average general practitioner earns gross in a year's time? There would be people who say $500,000. Now, that used to be true, but Eric, it's only about $180,000 that a general practitioner makes. Now, that sounds like a lot of money to a lot of people who don't make that kind of money. But folks, that's not a lot of money when you consider what a doctor put into becoming a doctor, with their education, opening their practice, all the equipment, insurance. They have huge expenses. So that's why Dr. Vicki Rachner, who we've partnered with, and we'll tell you more about how you can partner with her as well. She says in this book, physicians in private practice walk away from an average of 30% of their incomes when they don't follow up on rejected insurance claims. Outsourcing your medical billing could bring claim rejection rates to as low as 2 to 5%. Eric, ours is at about 2%, isn't it? So in our system, our cloud-based system, it allows you to get those rejection rates way down. And then she ends up by saying, this may be the fastest and easiest way to increase your cash flow. Eric, we're back to cash flow. That's what it's all about in any business. Look, I'm a CEO. I can tell you that no matter what problems we have as a company, if I have enough cash flow, I can solve those problems, whether it's personnel, buying new equipment, new training platforms, whatever it is, the cash flow solves those problems. Doctors need help with that. That's just the bottom line.
Yep, exactly correct. Now, we're going to go over 4 main issues today, or 4 main topical points today, as you can see here. Number 1, we know that doctors are in pain. They're in pain right now. Doctors themselves, they need a remedy. You, number 3, can be the remedy. And we're going to show you how ABS is going to be your support to support you being that doctor's remedy. So, Patrick, let's just first of all talk about, obviously, we could just simply talk about the doctors are in pain because we've already stated their pain points in some of the articles that we've already listed there. But that's just half of the problems. We already know that some of these doctors are struggling with insurance payments or lack of, the malpractice stuff that they're having to go through, difficulty with employers or colleagues or staff, anything and everything. I mean, goodness gracious, these doctors are under a lot of stress.
Yeah, look, it's the 5th one down, I think, 1, 2, 3, 4, 5. Income not high enough.
Yes.
That's one of the big things that are almost to the top there. We can't help with too many difficult patients, of course, but insurance issues, there you go. And we can solve a lot of the problems that doctors are facing, folks. You can, as you become trained. Listen, we've taken people from no background in this whatsoever. I've interviewed over 100 people so far on our website, YouTube channel, that will tell you that they did not have any background. Very few, Eric, what would you say? 1 out of 10 maybe who's had any kind of background in the medical field at all. Very few in the billing part of it at all. So we can teach you from scratch how to solve these problems for doctors.
Yeah, and then another quote that we get right out of the New England Journal of Medicine, that market analysis estimates that 24 cents out of every dollar is wasted on administrative billing expenses.
Yeah, 24 cents. Now think about that, Eric. Our licensees, of course, as you know, and folks, if you're not aware, you charge a percentage of what you collect for the doctors. So if you bill out and collect $100,000 in a month, you can charge 6 to 8% of that for your services. Doctors are spending much more than that, as you can see from this quote right here, if they're doing it in-house with their own staff and their own software.
Yeah.
So you can actually save doctors money and bring down their rejection rate to less than 2%.
Well, and everybody's wanting to know what is a denied claim or a rejected claim, and the United States Government and Accountability Office has this information. We've actually put this in the format that you can see there as a web URL that you can go to. And again, if you haven't yet downloaded the handout, you can go there directly yourself. But private insurance health insurance data on application and coverage of denials we're talking about here, the GAO reviews identified as a collective data indicative that variations in application denial rates across insurances have occurred for several years, with rates ranging from about 6% to over 30% in each of the 3 years. Now, Patrick, we know that there are some denial rates or rejection rates that are at that 25 to 30% range.
Yeah, not every doctor, of course, has that high a rejection. It depends on the staff, the software, a lot of factors factor into that. But folks, one of the big problems is that they send those claims electronically to what's called a clearinghouse. And a clearinghouse is an independent third-party company that has to scrub that data and reformat it for each one of the insurance companies. They can reject a lot of those claims right off the bat, and that's why it's so high. Now, with our system, Eric, I don't know if you go into this more later in the webinar, but we have it built in, right? The clearinghouse is built into our system, right. And we don't have to depend on a third party for that. That's why we can say with all assurance to people that our rejection rate is less than 2% nationwide for all of our doctors.
Right. And here's another one, HBMA, the Healthcare Business Management Association. Again, you fast forward today, and if you don't have some sophisticated claim scrubbing software, it's not unusual to have, again, here we go again, percentages 35% or higher in rejected claims. So folks, again, this is not ABS telling us this. It's not Murma saying this to you. These are major players out there. You got the government, and then one of the biggest associations in healthcare out there, Healthcare Business Management Association, telling you and the doctors why they should outsource their billing. That's an incredible piece of information. So again, folks, if you're trying to figure out, is this the right business to be in? I think, Patrick, we could stop here in the next 5 minutes and kind of shut down the webinar and not say anything else except for the articles that we've shared with you right now and just what we've read to you here from these couple of associations.
Yeah, Eric, in fact, I don't know if you noticed or not, but I did upload that short video that are doctors actually speaking about the fact that they outsource their billing and why they did it. Can we show that? Folks, this is just now before we show it, let me warn you that our videos, when we play them, the volume is not near as loud as me and Eric. So you might want to turn up the volume control on your computer to hear what you're about to hear on the video itself, and it'll mute us here. So Eric, let's just play that little video here, at least some of it.
On a day-to-day basis, practicing, I have a ton of paperwork. I have charts that have office notes from patients I see. I have follow-up lab reports, test reports. So a lot of time is spent not only seeing patients, but doing the paperwork that goes along with that. So probably for every hour I see patients, I'm spending at least 30 minutes worth of paperwork.
The complications of trying to do your own billing are greater than anything we do in medicine. It seems like with over 30 different insurance companies that we probably bill from, not even including our uninsured patients, there's absolutely no way. You don't have a chance.
And then when you submit a claim, it has to be a clean claim for them to even consider it. And you have to do it within 90 days. Doing my own billing was horribly tedious and very time-consuming.
To combat the problem, many medical practices and healthcare facilities are seeking help by outsourcing medical billing.
When medical providers outsource their billing, it makes them and their staff, of course, more efficient. It frees up their time so they can spend more quality time with their patients. And of course, it increases their cash flow, which is what it's all about. And for the patients, of course, the patients are getting to spend more quality time with the doctor and the staff, because the doctor and the staff are not having to spend all that time filing the insurance claims and doing the paperwork up front.
We have, as physicians, so many things to worry about. We have to be good business people. We have to be good patient advocates. We have so much on our plate. I go home and I do not worry about this, the most important aspect of our lives. We can't be good physicians unless we're financially solvent. At this day and age, with the complexities of the insurance companies, I can't imagine doing it any other way at this point.
The process for the Medicare billing is, with the electronic claims, is very difficult unless you outsource, because to do that in your office takes a lot of time, takes a lot of money to buy the software to do the electronic claims. So you pretty much have to outsource to save yourself money, basically.
From a billing standpoint, I have outsourced my billing. This allows me to not have to provide the overhead of an individual that I would have to pay to do my coding, do my billing, make sure that we're compliant with all of the regulations from Medicare and the other health insurance companies.
We've all been in this business for a while. We've all had our ups and downs with different billers. Finding a different biller, as we say, is like finding a good physician.
When you outsource your billing, you have to choose a company where you can track what's happening with each and every account. The billing company I use has the ability for me to check this online 24/7 at my convenience.
The person that we outsource our billing to has a wonderful online system, so we can check on claims, we can update patient information, we can input information into that, so that has made it very good.
None of us physicians ever feel comfortable with the follow-up if anybody's not paying or unable to pay, but it's still part of fact of life, and that's what they do. They can go after it. They can make any kind of suggestions as far as payments over months, X, Y, and Z, and it just takes me away from that and lets me again concentrate on either doing the business of medicine or further educations or just having free time.
When I outsourced my billing, I was able to give my headache to them and deal with the insurance company when they deny. Why did they deny? What is it that we need to correct? It doesn't have to be my personal headache.
Our focus is to do medicine, not billing.
A good physician has to be a good businessman. A good businessman has to decide, when to delegate responsibilities.
Outsourcing has allowed me to get better reimbursement on my claims because I have a whole billing company behind me to check things and take care of that.
Outsourcing has allowed me to spend more time taking care of patients while not worrying about the headaches that are involved with billing and the regulations that go with it.
Excellent. All right. So again, you hear the doctors themselves. You hear, again, we sound like we're beating a dead horse here about the number of claims that are rejected, and again, what's denied, and then a lot of claims that are actually denied. 50% of those that are denied never even get resubmitted. And Patrick, this is where doctors are where they are today. They were already there with some financial struggles. Then we hit this pandemic, and now all of a sudden they themselves find themselves really in a tight financial state.
I think that's why we're hearing back from licensees at this time, Eric, who are marketing right now, using some of the digital marketing, some of the non-personal contact marketing that we're teaching right now. We're hearing back from them that they are getting a huge response from doctors, because it's all about a problem and a solution, right? You have a solution, they have a problem, they know it, they recognize that from what we show the licensees to show them, educational type materials, and all of a sudden the doors are just opening wide open.
Exactly. And then the other thing that they're struggling with is the time in which they're actually getting paid. Even if there were no denials, sometimes it takes a doctor to get paid as far out as 90 days once they kind of start getting going here. I mean, Patrick, that in and of itself can be a huge downer as well.
That's right. And that's why, folks, when we say that we are the nation's largest network of medical revenue managers, that means you can be a part of something that's a large national network, and not just feel like you're out on your own. You know, you start your own medical billing business like my wife and I did, and you don't have anybody to refer to. When they ask you, well, what kind of experience have you had? You can't say, well, you know, I just opened a local office, but I'm a part of the nation's largest network of medical revenue managers. Being able just to say those words and show the certificate that we issue from the Medical Revenue Management Association of America, that gives you the credibility that you need to go out and feel really confident when you're approaching doctors.
You're exactly correct. And folks, so we've just gone through the first part. Doctors are in pain, and so we spent basically the first half hour of this entire webinar talking with you about the pain that doctors are under. Now we're going to kind of share with you some of the solutions, what you can actually be to the doctors as a remedy for them. And Patrick, it all starts with getting in front of these doctors and getting some involvement with them, and then starting what's called a practice analysis. Let's kind of go through what this will actually start to discover.
Yeah, so folks, we came up with this many years ago. It was one page. Now, as you can see, it's 3 pages. I think it's even 4 now, Eric. But the point is, this is a questionnaire that we've come up with that you can approach the doctor with, or the office manager in many cases, and basically ask them enough questions to get the data from them, the information from them, to know whether or not you have a solution. Do they even have a problem? That's what this finds out. And we show you how to go through this step by step, of course, in our online training.
And then when you get that information, you're actually collecting data here, as we're showing you in this practice revenue report. And I'm going to blow up this a little bit, but folks, you can see that in the middle there, it's what these numbers are what they have currently. And then we can show what's projected. And then we can also show right down here the projected impact on the practice of increasing revenue.
Yeah, so this is a report that once you've got that information from the practice analysis, you come back to your office, you plug these numbers in that they gave you into this spreadsheet, basically, that generates this report. And Eric, sometimes it's pretty shocking. If you were a doctor and you got this report from somebody that said, you know what, your monthly revenue increase could be 58% from what it is right now, a $10,000 more a month, or another $122,000 a year, wouldn't you at least kind of say, maybe I ought to look into this?
Of course. Yeah, absolutely. I mean, this enough will sell it for you. Now, I know that there's a question here by Rashman, and I want to address it because it's a good question here. He's basically saying, if you could guarantee me of getting 2 doctors or an office, a client, he said he would join without any doubt. Well, we wish we could guarantee everybody that ever joined us, they're going to get 1 or 2 doctors.
Sure.
Rashman, what it takes is your capabilities of taking what we have as marketing techniques and marketing positions out there, and you hitting those doctors right at the right moment. Right now, our licensees that have been around for a little bit, they've developed relationships. When they're going back to their doctors and adding another service, there's no doubt that they're adding doctors to their bottom line. So there's a lot of factors here, what it takes to actually get a doctor. A doctor needs to be ready. It's almost like you're asking us, you need to find me 2 doctors who are ready to sign up today.
Right.
I wish we could do that. If that were the case, all we would be doing is training.
Well, if you think about it that way, Eric, we really wouldn't need our licensees. Now, folks, remember, my wife and I were in the medical billing business, but once we started training and supporting other people, we didn't think that was right, that we stay in that business. Now, we do have a branch of our company that actually does some research and development and does billing for doctors to keep our finger in what's going on out there, but we're not in the business of signing up new doctors constantly. And we're not going to be in competition with you. If you're signing up with a company that's going to train you in this business that's also in medical billing, why couldn't they just take all your clients anytime they wanted to? I mean, I would be very scared of that. And if we had doctors ready to sign up, like I said, we wouldn't need our licensees, would we? But since we don't do medical billing ourselves as a company, then we're not always in competition with our licensees. We think that's a very dangerous thing to do. And there is one company out there, in fact, who not only are they in the business, Eric, of doing medical billing, but they sell their software that their licensees use under a different name directly to the doctors.
Right.
And again, that's being competitive with their own licensees, and it's just not our business model.
And if you think about it also from a business, if you're selling a business, let's look at these numbers right here. Imagine that you had a doctor that was generating $122,000 more a month. Now, this is just the bottom line of all of this. I mean, this is
right.
this is a huge number here that we're adding again to the doctor's bottom line. If we took that 2.5 times, which is normally if you're going to sell, a piece of business to somebody, and you did that times 2, you're talking about $500,000 worth of business here. Certainly, it's not going to be the $27,990 price that we have here either. So you got to think of this. This is a business opportunity. It's not like we've got a business that we can hand you that already have doctors ready for you to bill again. And we're just trying to help you discover that there's an effort on your side to go out there and get that business. What we can guarantee you is this. We will continue to keep adding new services, new marketing techniques out there that are going to get you in front of doctors. And we guarantee right now that we can pretty much get you in front of a doctor because we just added a new service that's not even on here right now, which again is the telehealth platform.
Hey, I'll tell you what, Eric. Now, I've never done this on a webinar, but let me just make sure that I see who it was that was asking that. Okay, so Rashmin, right? Rashmin?
Uh-huh.
Let me just say this. If you are willing to pay me not $27,990, not $28,000 for my license, but $128,000, I will guarantee you that we'll find you 2 doctors. How's that? You see, it's all value, right? So we could either charge a large fee like that and guarantee some people some clients, or we can just say, you know what? We're going to charge what we think is a fair price to train and support you in this business and teach you how to go out and do that. Because even if I gave you 2 doctors, at that point, you might still have to do some marketing on your own and have to learn how to sign up doctors yourself.
Correct.
So anyway.
All right, so here are some of the other parts of the riveting. We've got Audit Guard, Quick Collect, iDocs Now, Choice Pay, iClaim, AutoCard, EMRX, Compliancy Guard, and CodeWrite. So we have all of these different services. Call them door openers, call them services, call them whatever you want to call them. And again, we're still adding new services to the platform, even in the time of a pandemic. We're still adding new services, but it's going to get you in front of doctors, and it's going to help you understand, as it says, what gives doctors headaches. They're going to be listening to you right now about that.
Yeah, and the tools we've developed to help you get in front of doctors. Let's touch on that just a moment, Eric, because the book that let me grab one here. I have one right here.
Sure.
This book. This was co-authored by me and Dr. Vicki Ratner, and I'm going to hold that up. You guys can see it on the next slide, I think there. This is a book that is a paperback book that's available on Amazon for $24.95 for doctors to purchase. But not many doctors purchase this book. We use this as a marketing tool. You'll have a copy of it, just like you can see here, co-authored by Dr. Vicki Ratner, who's a famous doctor that's out there helping doctors with their practices in many, many different ways. She's partnered with us and our licensees to let you put your name on the front cover of the book, as you can see right here. See, where's that camera? There it is. Okay, forward by Susan Smith, CMRM. That stands for Certified Medical Revenue Manager. And that's what we certify you when you go through our training. So your name can be there instead of Susan Smith's because it's a very generic forward that we've written. Your name, as you can see, is on the inside title page there, and it's at the end of the forward. So you put your contact information there. This is a very nice business card, Eric, is what this turns out to be. And our licensees can purchase these with their name printed on and in the book for about $4 a copy. Yeah,
exactly.
It's a great marketing tool. Plus, you get an initial supply, of course, with your license.
And then when you go through training, we're actually going to show you because doctors don't have a lot of time to sit down maybe and read an entire book.
Right.
However, we're going to strategically have these little tabs that you can see right there on the book, and the doctors are going to automatically go there, and we're going to actually show you what areas of the book that you'll be able to actually highlight in those areas. So
Right.
obviously the doctor's going to go, what is this tab? And then it goes there and it opens up right there, and it's already highlighted in that area of the book.
Right. It's a very unique marketing tool, folks, but it builds credibility for you right off the bat. Even though you're not the expert, they will think you're the expert. You know why? Because your name is on the cover of a book with a doctor.
Exactly.
Yeah.
Let's see. Dylan's asking the question, do you think there is any chance in the coming years the HIPAA compliancy or the medical billing industry that could take us out of business? You know, Dylan, I mean, I wish we had a crystal ball, but Patrick, you know, that question, you and I have had that question over the last 12 years doing webinars, and we're still here.
Well, as soon as Obamacare came in, everybody thought, okay, so is the government going to take over this thing and we're going to become a single payer system?
Right.
Meaning only one entity, the government of the United States, pays the bills to the doctors. And that's how the doctors collect their pay. Now, that's true in some countries like Canada, Eric, but as you know, if you Google medical billing companies in Canada, you'll see that there's dozens of them. Why? Because the doctors do not want to mess with the 12 or 15 different entities that the government up there has that they have to bill for, so they'd rather outsource that even. So no, I think as long as there's human beings who get sick, and we can see that that's going to be around for a while, right? And as long as they go to a doctor, whether it's virtually through telehealth or otherwise, there's always going to be somebody who has to bill some entity that the doctor can get paid. Well, that's you. That's the business you're in, and it's been very profitable for 25 years. Eric, I don't see this going away for a long time, not in our lifetime at least.
Yeah, I don't see it, Dylan. So hopefully that will kind of help answer your question there. And then Philip's got basically a statement through a workers' comp attorney friend that I have. I could probably get started with 5 doctors, chiropractors, orthopedics, and a dentist to start. So, you know, that's what you're needing to know is as you're getting involved in this, do you have what you call your circle of influence and maybe some relationships that you can build off of? It may not be directly to the doctors, but like in Philip's case, it could be somebody that you know that they know doctors that they can put you in front of. Patrick, I think showing that the folks that are on the call today, that they can be the remedy, I want to first show what a typical billing scenario actually looks like. So in some type of a illustration here. And Patrick, we know that there are several billing softwares out there. I really do think there are so few billing softwares out there that are actually server type based softwares out there. It's almost unheard of even talking about a server based type of software out there where you actually have to load something on the computer, where you actually have to have a PC that has a CD or DVD built inside of it to actually do that. And there's not that many computers out there anymore that have that.
No, and yet, Eric, having said that, there is a company that does something similar to what we do that actually sells something that's still on a CD. Now, they don't say that on their website. You'd never know that. They say that they have a cloud-based system, but what they mean is you can set up your own server in your own office as a cloud, which means you've got to maintain that, you've got to back it up. And Eric, there's the problem. HIPAA rules say that you should not keep the patient data on any computer in your own office. But anyway, back to what we're talking about here. Basically, those old-fashioned softwares that are out there, folks, that reside on a computer hard drive, when they get ready to submit their claims, they submit it electronically to what's called a clearinghouse. Now, that's that third-party company I told you was set up just to receive the data electronically, reformat it the way all the insurance companies want to see it, because they all want to see it a different way, and then forward those claims to them. There's the hiccup right there.
Yeah, and it's like Patrick said, it's got to connect to some third-party clearinghouse, and then those clearinghouses will then have to connect to insurance companies. And again, you know, 15 years ago, this was the typical scenario that you would see, and it worked. It was just, again, it had its time to where, you know, some of the codes may not have been so complicated as they are now. Now that you've got tons of rejections, you've got a long time process to get from claim to clearinghouse, clearinghouse to insurance company. Our software is not only the practice management billing software, but we also have embedded in it our own clearinghouse. So we actually take out a step, and it's all web-based, so you're not having to load anything on your computer. It's like, Patrick, the other day I needed to get Adobe Pro. Well, you remember 5-6 years ago, you'd have to go to the store, buy the CD or the DVD, and then actually load it on your computer. They don't have anything like that anymore. Everything is software as a service right there on the computer, ready to go.
Right. So folks, ours is a true software as a service, meaning the software resides in the cloud, and you don't have to do anything with ours. You don't even have to download ours and install it, Eric. It's actually like you are going to a bank. If you do banking online, you know that you're just going to their site, right? And actually running what looks like software, but it's really through the cloud. That's what ours is, folks. It's wonderful because you don't have to worry about backing anything up or losing your data. It's all HIPAA compliant. And of course, because of the clearinghouse being built in, we have less than a 2% rejection rate, and we can get those reimbursements paid to the doctor in 7 to 10 days on average. Eric, I've seen it paid in less than a week. Yeah.
Absolutely. So as we kind of start wrapping up here, we got about 10 more minutes left, and we're going to go to our last little point here. And this is what you're going to get from ABS. You're going to get the support with the software here, and you're going to be delivered with the practice management system, the electronic medical records, the clearinghouse, the patient portal. And Patrick, one thing that's absolutely needed right now is that we already have inside of this setup a built-in telehealth platform where doctors, prior to even the COVID-19 outbreak, all we were now telling the doctors, hey, don't forget, you already have a telehealth program inside of your iClaim EMRX platform. Now's the best time to start using it, and doctors didn't even have to miss a beat there.
Yes. Now, Eric, I know that there's a lot more stuff we could cover. Can you skip though to slide 51? I'd like to start talking about the way we do support our people, because it's important. Once you've gone through some training with a company, are they going to be there for you? Folks, you can ask any of our licensees on our reference list. We've got dozens of licensees that will take calls from you. If you'd like to ask them, what is the support like at ABS? We have our own support website, which we're showing you some screenshots of it here, that's just packed with information. We've had that since, I think, 2014, Eric. So what is that, 6 years old? Right. 6 years worth of data on there. And folks, there's hundreds of hours, literally, of training that you can go through on our website after you've gone through our initial online training that's done one-on-one with a live instructor. There's ways to go into that website and set up our live demos for we do demos for your doctors to show them what the system's all about and answer all their questions. It's just packed with information for you as a licensee. And then, Eric, of course, as you know, we do ongoing training. We did a training this week, in fact, already, for our licensees. Yes. We do these on a regular basis, folks. This is just one little shot of one of our websites that has some of our videos on there. And if you look real carefully, you'll see that some of them right at the beginning, there's like 3 days ago, 7 days ago, and so forth. This is constant, folks. These are all an hour and a half long. And Eric, we don't charge anything for that. Nothing. Right. No ongoing support fees. Be sure and ask a company, look, after you support me for the first year or two or whatever it is, how much is it going to cost me after that? Because you will need support ongoing in this business. And we don't ever charge anything, nothing.
Philip says he's got to leave the webinar. How do we get in contact and talk? I might be interested, but I have some questions. Philip, just call us back. I'm going to give you our phone number here if you don't have it, 866-565-8413. Just call that number. If you don't know who your business coach or your business rep here is that to help you, business development rep here, just call us. We'll make sure that you get routed to the correct one, Philip.
Yeah, and we forward these notes or comments here in the questions on these webinars to those reps So whoever is your rep will definitely call you, believe me.
You bet. And Patrick, again, we help you with live demonstrations of the software. We have recorded versions of the demo. I just did a brand new one, an updated version of one actually today. But we're not giving you just recordings of demos so that you can show your doctors. This is a time, folks, and you got to listen to the depth of this. Imagine that you're going to get the experts over here at American Business Systems and our team of support people involved with you as a brand new licensee, involved with a doctor who may have been in business for 15, 20 years themselves. We're actually conducting demos for you on your behalf. Again, there's no extra charge for that.
And so we answer all their questions. You see, you're not stuck with, well, I don't know, let me check and get back with you. We're answering their questions. So Eric, we actually are helping the licensees to wrap up their clients by doing those demos for them. Oh, and folks, this is a site, one of our sites where we have support people who are actually supporting our licensees. Our technology partners are listed, they're located from coast to coast, and we have hundreds of people who are ready to help our licensees with their success in their business. So you're not just left to yourself out there, and you're not just left with somebody's sister-in-law who answers the phone in their office.
Patrick, you and I have packed in so much in this hour. I bet you we left out about 20 slides. So folks, when you go through the handout, you're going to go, gosh, we didn't go through this. We didn't go through this. Just count that as extra data that you'll have for yourself as you want to go through this. We know that we're up against the clock here, and we want to take some of your last minute questions. But folks, this is the solution. This is the cash flow solution here. That number one, you know the doctors are in pain. They're in pain right now. Doctors need a remedy. You can be the remedy, and ABS will be your support. So here you go, the Corona cash flow crisis solution. Can't name it any better than this.
Yeah. So let me touch on our guarantee, Eric, because a lot of people wonder how in the world can you get a money back guarantee on a business opportunity package like this. This is it's like a franchise, folks, except there's no territories and there's no royalties each month. And there's a lot of differences, but the point is, it is a licensing situation. And so how can we give a money back guarantee? Because couldn't somebody go through your training, get all your materials, and then go off on their own and start their own business? They could, but folks, in 25 years, we've only given a handful of people their money back. That tells you that we know what we have and we believe in what we have so much that we're willing to back it up. Now, if you're doing business with any other company that doesn't offer you that once you've gone through their training, if you don't like it or it turned out to be not what you thought it was, you can't get your money back, I would run as far as I could the other way.
Absolutely. And folks, again, you're going to go through the entire training. It can take you, like I said, a couple of weeks. And as you go through that, you can start evaluating whether this marketing is working for you. You can hear from your instructor there, start applying it. Join the webinars that we already have. And again, at the end of that training, you feel like it's not for you, again, just ask for your money back. That's the best that we can offer you on anything like that. Let's talk about some of the next steps here, Patrick. We're going to kind of go through these real quickly and then see if there's any last minute questions we have.
Yeah, we have a 50-page downloadable research guide. If you get back with the person who invited you to this webinar, they will get you a copy of that. You have to ask for that specifically. We have to be in contact with you directly. We don't just put that out on our website because it does have some very proprietary information in there about our business opportunity. Then be sure to go to our YouTube channel, youtube.com/YABS. Again, if you get the handouts over in the handout section, you'll see all this there and can not have to write this down. Then ask your ABS rep for an owner reference list. We'll give you a list of, like I said earlier, of people who are willing to talk to you that have been through our training and have graduated and started their business. As for a live demo of our iClaim EMRX platform, we not only do demos for your prospects, but we can do that for you individually as you're looking in and doing your due diligence about our business. Then finally, review the purchase agreement and the funding instructions and get enrolled in one of our training classes. Folks, those slots that we have for training, they're very limited. Very limited because, again, they're one-on-one with live instructors, and they're on your schedule, and it's going to take you, 12 to 15 hours to get through that. But believe me, it's very in-depth training.
Yeah, and so we're talking about the live online training here. And so, again, it's going to be at your pace. We were doing social distancing already, even before social distancing was ever a terminology here to some degree. But we're going to do it at your pace. Obviously, imagine if we were doing live training right now and we were not being able to do this. We already had this planned at the beginning of the year that we made this turn, and I'm so glad we did, Patrick, because we're not skipping a beat. We're not missing a beat. Our brand new licensees are not missing a beat. So, right, folks, we've got this way under control here.
And folks, if you're thinking about starting a business, what a better time when you have the time to be able to go through this training and really do your due diligence like you should, checking this out, checking the business out. This is the time to do it. Believe me, there's no better time than to get ready right now, so that when everything does go back to normal, I'm convinced in another month or so, hopefully, you'll just be ready to hit the road running.
You bet. Folks, I put over in the chat area that one article that I shared with you from Fierce Healthcare. Go get that one and read that whole article. It's about how doctors need to help themselves increase their revenue. And Patrick, one of the best things that we ever do on webinars are interview with successful licensees. You are going to be interviewing Jeff Bruner next week, so I'm going to let you talk about a little bit about Jeff, and I'm going to put that registration link again over in the chat box so everybody can grab that too as well.
Yeah, that should show up in if you're on a computer, in your question box. If you're on a phone, it might be a chat that it shows up in. But go ahead and register for that right now, folks. You don't want to miss a live interview with somebody who's been through what you're going through right now in doing your due diligence. They've been through the training, the live training. They've gone through all that it takes to get up and running. And Jeff is a very credible guy. You're going to love talking to him. You can type in your questions directly to him throughout that interview next week. And so go ahead and register for that. Even if you don't know if you can make it or not, we'll send you a link to the recording of it, of course, because we record all of these.
All right, I'm going to put these steps here for your success here, along with our phone number, 866-565-8413. And Patrick, let's just kind of see if there's any last minute questions that we may have missed or skipped over. If we did, we certainly didn't do it by on purpose or anything, but I think we got all of them. Oh, here's one from Donna. I think we missed this one. Donna, can you work in different states, and do we have to be licensed in each state where we work? You know, unlike doctors have to be licensed in the state, so a doctor, especially right now with telehealth, a doctor could be residing here in Texas, but might see patients in Louisiana, or they have to be licensed in that particular state. They just can't see patients in Louisiana. However, you as a medical billing company, you can practice anywhere. There's no certain license that you have to have. So whether you work in Georgia and you've got doctors in Arizona, you're okay with it. There's no specific licensing that you have to have.
Yeah, in fact, one of our instructors, Cynthia, she actually started her business and now has clients in several states. And she says, I've never been to any of those states to visit those clients because they're referrals from other doctors. And if you've got a doctor who you're doing a good job for them and they're happy with you, they refer you to another doctor. It doesn't matter where that doctor is, because you can do it all online over the internet. You don't need to be anywhere in person for them to sign up with you.
Patrick, I think we've accomplished what we wanted to accomplish today, and I think we got all the questions in that we need to get answered there. So, folks, let me tell you, thank you for joining us. I want you to join our webinar next Wednesday. Get engaged with your business development rep that you're working with here at American Business Systems. If you haven't seen a live demonstration of the software, get with them. Ask them about the new services that we have in telehealth, and they'll share a little bit about that with you, and how that in and of itself is becoming one of the fastest door openers that you can imagine that's happening right now.
Yeah, and so folks, again, if you're looking to get into a business, do your due diligence. Take your time. We're going to be here. It doesn't matter how quickly you sign up. That's why you don't see us doing the big sales pitch on these webinars, trying to get you to sign up now. If you don't sign up by the end of the webinar, you're going to lose this discount or this bonus or anything. It's the same price for everybody that comes through this, and always will be, although the price has gone up over the years, slowly but surely. Eric, when we started way back, I'm talking about even before you came on board 12 years ago, we were selling the license for less than $15,000. So
Right.
it does go up over time, because when we add more services and more tools, it becomes more valuable. And so that means it will always be higher the next year probably. But for now, folks, $27,990, that's a bargain to get into any business opportunity like this. So do your due diligence. Hope we see you on next week's webinar, and go back and get back with the person who invited you to this and ask them for all those goodies there on the screen.
Absolutely.
Thanks for putting this together, Eric.
Oh, it's my pleasure. Everybody have a great day and stay safe, and we'll see you next Wednesday.
All right, bye for now.